Generation ago in 1988, Paul Aguilar was diagnosed with HIV, which at the time was largely considered a death sentence. He says he wasn't sure if he would live another 5 years, let alone live to see the year 2025. Amanda Harry introduces us to him and explains why he is now worried about future patients.
Things I keep reminding, especially young people, a budget is a moral document. A budget.
For a long time, an HIV diagnosis was considered by many to be a death sentence. Now people like Paul Aguilar are thriving.
It's a place where we live with HIV. We don't die from AIDS.
We met Aguilar at Marty's Place, a housing co-op for low-income people living with HIV/AIDS in San Francisco, a place Aguilar has lived for years. He was diagnosed with HIV in 1988. He never thought he would see 2025.
When you're told at the age of 25 that you have 5 years to live and you better clean up your life and do whatever it is you need to do, that's really frightening.
Advancements in HIV treatment allowed him to celebrate his 62nd birthday last month. But he's worried with HIV prevention and research cuts, some other people won't be as lucky.
It's really scary. It's like we're throwing back to 40 years ago. You're going to see an epidemic the likes of which it's going to be even worse than what I walked through, because you're going to see medically resistant strains, you're going to see super strains, and there's no scientific or medical research being done on how to address this.
President Donald Trump's 2026 budget proposed significant cuts in CDC-funded HIV prevention, testing, and research. But Governor Gavin Newsom and state legislators are trying to combat that. Tuesday, he signed a budget that allocates $75 million to HIV and STI services. Jonathan Froxswag with the San Francisco AIDS Foundation says $10 million is for hepatitis C testing equipment and public health workers who do contact tracing for HIV. The rest acts as protection.
The bulk of the money is $65 million in a contingency fund that the state can tap into if the federal government cuts dollars for critical HIV services, everything from prevention to care to housing.
He says prevention efforts are vital as California sees 5,000 new HIV cases each year.
We know what prevents HIV transmission. We have those tools. It's things like low barrier HIV testing. It's things like distributing safer sex supplies, helping folks get on PrEP. And those tools we need funding for.
Aguilar was cautiously optimistic about the funds.
75 million is not enough. You know, we definitely need more. We'll take what we can get.
As of 2025, life expectancy for people living with HIV who are diagnosed early and receive treatment is nearly the same as the general population. Aguilar believes this is proof there could one day be a cure. He says there needs to be more research to find it.
We're so close. We are so close to ending it that it would be foolish for us to stop now.